Hi, I'm Dr. Joel Cherdak, President of Denver Regenerative Medicine. If you've been researching GLP-1 medications like semaglutide or tirzepatide, or peptides for weight loss, performance, or longevity, you've probably noticed two very different treatment options online. On one side, you'll see licensed compounding pharmacies working directly with medical providers. On the other, you'll find online sellers offering peptides like GLP-1s labeled as quote-unquote research grade or quote-unquote for experimental use only. At first glance, these options may look similar, but from a safety, legality, and medical standpoint, they are very different. Today, I want to explain the key differences and why physician-supervised care matters when it comes to injectable therapies. What is a compounding pharmacy? A compounding pharmacy is a licensed pharmacy regulated at both the state and federal level. These pharmacies are inspected regularly, must follow strict sterility and quality standards, prepare medications only with a valid prescription, document sourcing, storage, and preparation. Compounding pharmacies work directly with physicians to customize medications such as GLP-1s based on dosing needs, titration schedules, and patient tolerability. In other words, these medications are part of a medical treatment plan, not consumer products. What are online research-grade suppliers? By contrast, many online peptide or GLP-1 sellers operate outside the medical system entirely. You'll often see language like for research use only, not for human consumption, experimental use only. That wording is important. It exists because these products are not FDA-approved medications. They are not regulated as drugs. They are not intended to be prescribed or supervised by a physician. There's no guarantee of purity, sterility, accurate dosing, or proper storage and handling. And importantly, there is no medical oversight guiding how or whether these products should be used. Regulation and safety. The key difference. This is the most important distinction. Compounding pharmacies are regulated. Online research suppliers are not. That means no mandatory quality testing, no requirement to disclose manufacturing conditions, no accountability if something goes wrong. With injectables, especially GLP-1s and peptides, sterility and dosing accuracy are not optional. Errors can lead to infections, severe GI side effects, electrolyte disturbances, gallbladder or pancreatic issues, and dangerous under or overdosing. Medical regulations exist to reduce these risks, not to make access harder. Why MD supervision matters. Having GLP-1s or peptides prescribed under physician supervision offers several critical advantages. A physician evaluates your medical history, current medications, contraindications, lab values when appropriate. Treatment is then started at appropriate dosages, adjusted over time, monitored for safety effects and effectiveness, and if a problem arises, you have medical guidance, not a customer service email. This is especially important with GLP-1 medications, which affect blood sugar regulation, gastrointestinal mobility, appetite signaling, and metabolic hormones. These are powerful tools, but they should be used within a medical framework, not guessed at independently. Informed choices lead to better outcomes. GLP-1s and peptides can be effective therapies when used appropriately, but how you obtain them matters just as much as what you take. The difference between a compounding pharmacy and an online research supplier is not convenience. It's regulation, safety, and medical accountability. If you're considering these therapies, my recommendation is simple. Choose regulated sources, work with a physician, follow a structured treatment plan. That approach isn't about restriction, it's about protecting your health and maximizing results. If you'd like to learn whether GLP-1 or peptide therapy is appropriate for you under medical supervision, we're happy to help. I'm Dr. Joel Cherdak, President of Denver Regenerative Medicine.